just to summarise, we have a relatively heavily restored dentition, and we have a lower right 6, which is very heavily restored, and it is under-contoured. The patient has come in with this very heavily restored lower right 6, and the restoration keeps on failing on it. And they've come and seen you as a dentist, and they simply want to have a filling in this tooth which stays in, because it's been a bit of a pain that it just keeps on coming out again and again and again. So it's a kind of scenario where you'll come across on a regular basis in your practicing life, and you might look at it and go, well, I just need to do a new restoration there. That shouldn't be too difficult. The tooth's quite heavily restored, so you might even think about doing a crown on the tooth, which would be entirely reasonable. The main problem that you will come across with this case is that you have over-eruption of the opposing first molar. Okay? So you've got an under-contoured lower first molar, and that's been like that for quite a while. And because of that, the opposing upper molar has over-erupted down, and therefore, when the patient bites together in ICP, you've got absolutely no space to restore the lower tooth back to any kind of normal contour. And so that's why the restoration keeps on failing. So, how do you get around this problem? Well, because this restoration in the lower tooth is really large, there's very little retention for a direct restoration in this situation. So it would be quite sensible to think about doing an indirect restoration, doing a full coverage crown. And hopefully that will be retained better. The problem is that to do a crown on this lower tooth, because you've got over-eruption of the opposing upper 6, you've got no occlusal space there whatsoever. So when you do a crown preparation on a posterior tooth, say for example you're going to use gold, so you're going to use the material which requires the least amount of preparation, you still want about 1 millimetre of preparation, 1.5 on the functional cusp, don't you? So to do that, you're going to have to prepare this tooth by removing about 1 to 1.5 millimetres occlusally. But if you notice, it's already significantly under-contoured. Okay, so if you prep that and reduce it down by another mil to 1.5 mil, there's going to be hardly anything left of the tooth. And then it's going to have no resistance and retention form in order to retain that indirect restoration. And you're still not taking into account the fact that you've got an over-erupted opposing tooth, which is going to cause problems with the occlusion and is not giving you enough space to actually restore that lower tooth back to a normal contour. So how are you going to restore that lower tooth? It's quite a tricky one, and there's no easy answers. And the main problem is this over-erupted upper tooth. Now, what you want to do ideally is you want to reshape that upper tooth back to normal contour. You want to get its occlusal plane back up to where it should be. But it's over-erupted by about 2 millimetres. So you could think about doing some adjustment on that upper tooth and reduce it down by about 2 millimetres. But if you do that, clearly you're going to end up with quite a lot of dentine sensitivity. You can't just do that, can you? You can't just take 2 mils off a tooth and not restore it. It would solve the problem, it would give you enough space to restore the lower tooth, but you would have created another problem for the upper tooth in the meantime, wouldn't you? So how could you get around that? How can you put this, how can you get this tooth back to its proper occlusal plane? Well, you could think about maybe doing an onlay or a crown on it, potentially. And therefore, when you do the new crown, prepping it in such a way that it would allow you to get the occlusal plane back to where it needed to be. That way you would then have enough space for the lower tooth to restore it. The problem with this lower one, with the upper one, is because it's over erupted by 2 millimeters, you need to reduce it by 2 millimeters just to get it back into the right occlusal plane. But then if you're going to crown it, you need to reduce it by another mil to 1.5 mils in order to create enough space for the crown to go on there and to maintain the occlusal plane where it needs to be. 2 millimeters, you're going to use porcelain. That means then that you'll be taking off 3 to 3.5 millimeters from the occlusal surface, which if you do that, you'll probably start to see some pink, won't you? So how do you get around that problem? Well, if you were going to go down that route, the only solution would be to do an elective root canal treatment, prep it heavily, put a crown on it at the new occlusal plane, and then crack on with the lower tooth. But that's a lot of treatment, isn't it? Just for a patient who comes in saying, I just want a filling to stay into this lower tooth, and suddenly you need to do root canal treatment and a crown to the upper tooth before you even start working on the lower tooth. It's a lot of treatment, isn't it? But if you don't do that, you're never going to have enough space to actually restore that lower tooth properly. So I'm not saying that that is the actual solution, but what I'm saying is that this is a really complex situation that you need to notice this before you start having a go at these kind of cases and thinking about all of the options and all of the problems that will come across as you start treating cases like this. Another option is that you could potentially think about doing some crown lengthening surgery on that lower 6. Okay, so crown lengthening where we remove a bit of the gingival tissue and bone around that lower tooth, and that will then give you a bit more crown height in order to restore the tooth with an indirect restoration. So you could do that. The problem is that you're not addressing the over-erupted upper tooth in that situation, and you're still going to have an occlusion which is quite significantly out, probably quite a lot of interfering contacts, etc., etc. Okay? So a good example of a relatively simple problem, i.e. a lost restoration or a repeatedly failing restoration, but with very complex problems associated with it due to the occlusion. Okay? In an ideal world, you don't want this to happen in the first place, and that's why we want to make sure that we're not under-contouring restorations and that we aren't allowing upper teeth to over-erupt by leaving them with unopposed contacts. Okay? Any questions about number 6? Yeah? Intrude that upper 6 back up. Now, the problem there is that to intrude an upper 6 is probably the worst tooth that you could want to try to intrude, because obviously it's big tooth, 3 big roots on it, and you're going to need a lot of anchorage to actually push that back up again. And what may well happen is that you might get more of an extrusion on teeth which were providing your anchorage for you. So it's quite a complex case for an orthodontist to intrude an upper 6 back in. I suspect they wouldn't appreciate it if you asked them to do that. Another option is potentially, there's been 1 or 2 cases where you can have a posterior bite plane made, where basically you get the patient to wear some kind of appliance or bite plane in the lower, where the upper tooth is the only tooth in contact. So a little bit like a Dahl appliance, if you like. And the patient will bite down onto that bite plane, and that'll gradually, over a few months, bang that tooth back up into the arch. It's a little bit uncontrolled, and you know there's potential for the lower teeth to be intruded a bit as well. So it's more of a sort of experimental to a certain extent, but it is a possibility. So it's sort of option 4 of all the options.